All right. Welcome, everyone. Thank you for showing up today. We appreciate you taking the time to sign in and learn a little bit about Medicare. We have an expert on the line, which I am certainly not. Sherry Smith, who I've known for several years now, is going to take over in just a few minutes, and she's going to walk through the ins and outs of Medicare. She'll teach you way more than we could ever teach you. But one of the things that we want to do for all of our client base and the people that work with us is bring outside experts in order to teach on things that we don't know enough about but are very important to the people that we work with. So Sherry's one of those people. So our plan is to continue to do these types of meetings over several months on different subjects. So if you had any recommendations on something that you would like to see, please let us know and we'll take that into consideration. But I met Sherry a couple of years ago, and the way that I met her was that a client came in and just raved about the experience they had going through the Medicare process. And I said, well, I need to know who that was. And it turned out to be Sherry. I touched base with her, and we've referred several clients to her. And every single time that they come back to us, the report is, wow, we had a great experience. She's fabulous. She walked us through. We understood it all. And we really appreciate the referral. So when we find people like that, we want to work with not only top-level professionals in other fields, but people who are nice and people who we get great reports back from the experience they had when we refer them out. And that's always been the case with Sherry. So we are happy to have her here. We're glad she took the time. I've experienced a little bit of this. I'm her worst client, by the way. I experienced a little bit of this because a couple weeks ago, I had to sign up for Medicare because I'm turning 65 on October 7th. And it's a daunting process to me, even though I kind of know what it is and a little bit about how it works. So I immediately reached out to her. She gave me some homework. I haven't done half of it. So she's probably thinking, yeah, buddy, take your own medicine here. But she's very patient and she's very understanding, but absolutely an expert on the subject. So I'm not going to talk anymore. I'll let her tell you about a little bit about her background and experience, but I'm going to pass it over to her. I'm going to give her the ability to be the host if I can find her. And then once we get there, she's going to share a little bit, or not a little bit, she's going to share her presentation. Okay, this is why I need young people. I think I just got you over to being the host.
You did. Thank you.
All right. Fantastic. All right. I will get out of the way. I'll mute myself and you can take it over. And we'll come back at the end for questions. You can put them in the chat or you can save them for the end. And I think it'll be better just to do them all at one time.
Sure. Great. Well, thank you. It's nice to have everybody on the call today. I'm going to share my screen with you and do a Medicare 101 presentation. Let's see if I can attempt this myself without destroying things. See, I'm right there with you, Joel. Let's see, where did you go? There we are. Can everybody see my screen okay? That's probably a little bit better. Okay, perfect. Well, my name is Sherry Smith. I am a licensed agent. I'm actually the president and owner of SLS Benefits. I have been licensed since 2003. I did group and individual insurance prior to doing Medicare. I jumped into Medicare. This will be my 17th year doing Medicare. I absolutely love it. People think I'm crazy. I have a lot of information, a lot of experience when it comes to Medicare in all different aspects. And what I like to do is debunk a lot of the things that people have perhaps told you that you should be doing or not doing, or when you should be doing those items. So hopefully today this will give you some clarity as far as the different things that are available with Medicare and what you should be doing and what time frames. And I'll be more than happy to answer any questions that you folks may have. To the next page, if it'll let me. Yeah. Give me 1 second. Oops. Okay, Microsoft, it ran into a problem. Let's see if that's solved. All right. So who's eligible for Medicare? All righty. Well, it's not gonna let me. Okay. There we go. Okay, so ways you become eligible for Medicare. It's going to be the obvious one, with most people think is turning 65 or older, or if you're disabled under the age of 65 and you're receiving Social Security disability payments for a consecutive 24 months, that'll also make you eligible for Medicare. Folks who have end-stage renal disease or ALS are also eligible for Medicare, and you must be a U.S. citizen or at least a permanent resident for 5 consecutive years to be eligible for Medicare as well. This is the #1 question I think people ask me is, how do I go about getting signed up for Medicare? If you're already on Social Security, the good news is they're going to sign you up for Medicare automatically when you turn 65, and you'll receive your Medicare ID card 3 months prior to your birthday month. If you're not on Social Security, then you're going to need to take the necessary steps to sign up for your Medicare. And you can do that 3 different ways. The path of least resistance is if you can do it online on the Social Security website. It's www.ssa.gov. Most people already have an account that they've created on that website. So you can log in there, find the benefit button. Then you would hit Medicare and apply for your Medicare benefits. It takes about 15-20 minutes to complete the application online. Now, if you're like some people where you're not internet savvy, you can also call Social Security and you can schedule a phone consultation. And in some counties, you may be able to schedule an in-person appointment as well. If you go this route, I recommend that you start this process sooner versus later. So one of the questions people will ask me is, when should I actually start this process of applying for just the Medicare Part A and B? I tell people, call me 6 months out from the time you're going to retire or turn 65, and then let's put a game plan together. It generally takes 4 to 6 weeks to process an application. So you could be almost 2 months before it's finalized. If you do a phone consultation, it could be 2 months plus before you even get the phone appointment. So you're looking at potentially doing it by a phone call, a 4-month time frame before they process your application in full. So I recommend you start this process sooner versus later. And then, like I said, it does vary by the local Social Security office of whether they're taking in-person appointments or not. So just to go over some Medicare basics, we're going to talk about Part A, which is your hospital benefit, Part B, which is your medical. This is really the meat and potatoes of your Medicare benefits. And then we're going to talk about Part C, which are your Medicare Advantage plans. We're also going to talk about Part D, which is going to be your drug coverage. And we're also going to talk about an additional option that's available when you go on Medicare, known as a Medicare supplement. So underneath Part A of Original Medicare, this is your hospital insurance. It's going to provide coverage for your inpatient stay in a hospital, nursing home, hospice care, and some coverage for home health care. Please keep in mind, Medicare only covers 100 days in a skilled nursing care facility. And then you'd be on your own, either the state of Ohio or whatever state you may live in. You may have to do a spend down program to have the state pick up some of the additional expenses, long-term care insurance, or obviously your retirement or savings. Hopefully that's not the case. Part A is a part of original Medicare. Part B, for Part A, this is what I wanted to talk about. Part A's costs. If you have worked 40 working quarters.
Oh, there we go.
In your lifetime, you will pay $0 for Part A. If you worked less than 30 hours, then you will have a $285 monthly premium to pay for Part A. So most people are not aware of this 40 quarter requirement to have a $0 premium for Part A. And if you have less than 30 working quarters, then you're looking at $518 for a monthly premium. Now, most people have worked 10 years or 40 working quarters in their lifetime and don't pay anything for Part A. If you're concerned, because maybe you were a stay-at-home mom, you may want to give Social Security a call just to make sure you do have those 40 working quarters. You can also draw off of a spouse that may have the work history as well. Part B of original Medicare, this is the medical portion. It provides coverage for your doctor's visits, preventative care benefits, outpatient surgeries, diagnostic screenings, preventative care as well, emergency care, and durable medical equipment. There's a whole slew of things that fall underneath Part B this is just a short condensed list of items. Part B, unfortunately, is not free for most individuals. You're going to pay a standard premium. This year, that standard premium was $185 a month. If you have higher earnings or reportings to the IRS, you could potentially pay more for Part B. This is called IRMA, and it's an acronym, and it stands for Income Related Monthly Adjustment Amount. IRMA sounds like a hurricane, huh? It kind of feels like that because it's a nice additional amount of premium that you could potentially have to pay. So this year for 2025, the income guideline is looking at, for a single individual, $106,000 is reported on their tax return, and $212,000 for a married couple. Now, here's the kicker. They are looking back 2 years. So if you're going to go on Medicare in 2026, they're going to look at 2024's income. And they're looking at the modified adjusted gross income, and that number is not located on your tax return. So you may need to contact your accountant and find out what your modified adjusted gross income number is. Now, we're all aware of, things can create income levels to change, and they can change pretty dramatically. For instance, what if your spouse passes away and you no longer have that resource of income? You can dispute IRMA. You have to fill out some paperwork as to why you want to dispute that amount, but you can dispute that amount and get it lowered down to the standard premium. It's about a 50-50 shot. These income levels go up every year, as we normally should have an increase in our income from year to year. So these income levels will go up from year to year. But the standard rate for this year is $185. What they're projecting for 2026 is going to be closer to $200 as a monthly premium. Now, if you don't draw Social Security, because normally that premium comes out of your Social Security check, if you don't draw Social Security, the premium then will be billed to you on a quarterly basis. You can pay quarterly by mail, or you have the option to set up auto pay out of a checking account. Some folks might not want to pay that large of an amount in a quarterly basis. Okay, so that's going to be your Part B cost. Here's another topic I hear all the time. I'm turning 65. I'm told I've got to sign up for Medicare when I turn 65 or I'm going to be penalized. That may or may not be true. If you didn't sign up for Part B when you were first eligible and not covered by a credible employer plan, you may have to pay a late enrollment penalty for as long as you have Part B. So if you called me today and you said, I'm looking at retiring next year, I'm over 65, maybe I'm 66. The first question I'm going to present is, does your employer provide credible coverage? And if they don't know, I'm going to refer them to their HR benefit department to get that in writing. Employers are required every year to provide an annual notice in regards to the employer plan of whether or not it's providing credible coverage under Medicare rules. So you have to be very specific when you're asking for this documentation and that it's pertaining to Medicare. Because some of the changes that are coming for next year, employer plans are seeing increases on their rate, on their renewals for next year. And part of this has to do with some of the changes that we're going to talk about here in a moment with prescription drug costs. The monthly cost may go up to 10% for each 12-month period that a person doesn't have Part B if they don't enroll. So the key here is credible coverage under Medicare rules on an employer plan. Okay. It also says you don't have to pay a late enrollment penalty if you meet certain conditions that allow you to sign up for Part B during a special enrollment period. Those are very far and few between. Original Medicare, it generally covers 80% of your hospital and medical expenses. Original Medicare does not cover things like deductibles, co-pays, co-insurance, no coverage for prescription drugs. You have to get a standalone prescription drug plan of some sort. Healthcare outside the U.S. So if you leave the United States, the way Medicare works is it will cover you within certain proximity to the U.S. border. I don't know how close of the U.S. border you have to be that proximity. So we do have some other resources available for folks who like to travel international. We do provide travel health insurance in the event that you do need coverage outside the U.S. As we stand, hearing aids, exams, screenings, eye exams and glasses and dental is not covered by Medicare. There's a big push to have this covered by Medicare, because as we see on a lot of these Advantage plans that are on the market, they include these additional benefits, but they're only on the Advantage plans. And it makes it a little unfair for those who decide to keep their original Medicare. So we'll see if we make any changes down the road in these two particular benefits. So the first option that we're going to discuss when you go on to Medicare is going to be a Medicare supplement. These are also known as Medigap policies, and it fills the gaps of original Medicare and what it doesn't cover. So it can cover those deductibles, co-pays, co-insurance. It gives you the freedom to choose any Medicare appointed doctor in the U.S. So if you plan on traveling after you retire, or maybe you want to become a snowbird, what have you, you can have access to any doctor in the U.S. that accepts Medicare, and that's 97% of the providers in the U.S. These are standardized plan letters, associated services. In other words, these are considered federally standardized plans. They range from Plan A to Plan N. And it doesn't matter who your insurance company is for the supplement, whether it be Mutual of Omaha, Blue Cross Blue Shield, Physicians Mutual, what have you. That Plan N or Plan A or what have you is going to be the same with every single insurance company. What's going to vary is right there, that monthly cost. That will vary. And we are seeing some increases with some of your bigger name companies who've been around for a while in the supplement market are getting 20% rate increases as we speak. Some of the other items that you may receive on a Medicare supplement could be some additional benefits like discounts on dental, vision, and hearing. Not true insurance, but discounts. And some do provide a free gym membership. I'm sure you've heard of Silver Sneakers. That's a big one in the Medicare sector. And we do have some companies that do provide a free gym membership on the Medicare supplements. These are going to have higher premiums. It's going to be more comprehensive coverage on the medical side. It's not going to provide you all the bells and whistles that you hear about on Advantage plans. It's going to give you more protection on the medical portion. Medicare supplements do not cover any prescription drugs. You do need to have a prescription drug plan in place, because if not, you could be potentially owing a late enrollment penalty. So you can purchase a standalone prescription drug plan, or if you have some other type of credible coverage like the VA. When it comes to prescription drug coverage, there's two types. Again, you have a standalone prescription drug plan. You have to have original Part A, Part B of Medicare, or both. Or you can get prescription drug coverage through a Medicare Advantage plan, which also includes the Part A and Part B coverage. And we're going to talk a little bit more about those in a moment. Part D coverage, it covers your prescription drug costs, some of it. And you must continue to pay your Medicare Part B premium, and you must live within the Part D plan service area. So most of these plans are filed by county and by state. So if you decide to change your residency, you need to notify the plan because you may have to switch up to a different plan that's available in your area. Most of your standalone prescription drug plans are national and cover the whole entire state. So those are usually an easy change. As I mentioned before about not having prescription drug coverage, if you don't sign up when you're first eligible or did not have that credible coverage for more than 63 days, you may have to pay a late enrollment penalty for as long as you have Part D coverage. That penalty is 1% of the national base premium, which that means basically the base premium of all the Part D plans available across the US. Right now, the average is $36.78 in 2025. You multiply by the number of months that you were not covered while eligible. So for example, if we take the $36.78 and we signed up in 2025 after missing 10 months of coverage, my penalty would be $3.70. That stays with you for your lifetime. Okay. So when people are coming off of, let's say they're retiring, again, I recommend calling me 4 to 6 months in advance so I can tell you what steps you need to take so that we don't have any break in coverage longer than that 63-day period. Prescription drugs had a little bit of change in 2025. If you remember back in the day, not too long ago, we had what was called the donut hole. It was known as the coverage gap. And this was a nightmare for people on Medicare where they had to pay more costs for their prescription drugs. That is gone as of 2025. We only have 3 stages left now. And our first stage is known as a drug deductible. The drug deductible range can be $0 up to $590 for 2025. That number's going up for 2026. It's going to be $615. 99% of the Part D plans next year will have a drug deductible. The second stage, or let me go back to the deductible. Generally, the drug deductible does not apply to tiers 1 or 2, which are going to be your generic drugs. Usually the drug deductible will come into play when you start to get into the more expensive medications, your brand name drugs, or I say the drugs you see advertised on TV. They're going to be usually subject to a drug deductible. The next stage is known as your initial coverage stage. These are going to be your co-pays, co-insurance that you pay once the deductible's met, if it's applicable, until you reach the max out of pocket, which is $2,000 for 2025. So this came out of the Inflation Reduction Act. Next year, that number is going to go from $2,000 to $2,100. So there's a minimal increase on the exposure next year. Once that $2,000 or the $2,100 has been met, you go into stage 3. This is known as your catastrophic coverage. And once you've reached this level, then your drugs are zero cost to you. Now I'm going to pause here for a moment because I have some folks, unfortunately, they take very expensive medications. And I have an individual who meets that $2,000 mark, her first fill in January. And I was really happy to meet with her this year because I could tell her that she didn't have to pay this large sum of money in January when she goes to pick up her prescriptions. And the reason why is because another item was implemented through the Inflation Reduction Act, and that was called a Medicare prescription payment plan. So instead of spending $2,000 in January, I advised her to go home, call her prescription drug insurance company, and make payment arrangements. So she was able to break that up over monthly increments and only pay $166.67 instead of $2,000 in one shot. So that's really good news for Medicare beneficiaries. We're minimizing the out-of-pocket cost. Not happy it's $2,100, that's still a lot of money, but I can remember very recently people having to spend $3,000, $4,000, or $5,000 out of their pocket for their medications in a year. So that's really good. Oh, you can also save on drug costs. Now you can qualify for extra help through Medicare. This is a federal program. You have to meet certain income and resource limits to qualify. Sometimes folks get confused when they start thinking about extra help. They think about Medicaid and, you know, they're going to take my home or car and I'm going to have to sign over my life insurance. That's not the case with the extra help on the prescription drug costs. What they're going to count in assets is going to be any money you might have in a checking, savings, or a retirement fund, stocks and bonds. What they don't count is going to be your home, car, again, your burial plot, furniture, household items, things of that nature. You can apply for extra help on the Social Security website. You can also call Social Security and apply online, or you can even call your prescription drug plan and they will help you apply. I want to go back to this screen for just one moment on prescription drug costs. One other item I did not mention is that we have in 2026, we're going to see the list of the first 10 prescription drugs that were price negotiated by Medicare from Big Pharma. So there are Eliquis, Entresto, Jardiance, to name 3 of them on the list. They have negotiated a cost down. We have seen Eliquis retailing around $600 on Medicare. The last I've heard, it was down to around $200 retail. So that will hopefully bring some costs down on prescriptions. So there's a list for 10 for 2026. And then each year moving forward up to 2030, there will be another 10 to 15 medications that will get price negotiated between Medicare and the pharmaceutical companies. Now, what could change this is an executive order that was signed by Donald Trump, where he would rather see international pricing come into play. And what that simply means is we're not paying any more here in the United States than what they're paying for prescriptions if we were in Canada or New Zealand, India, what have you. Okay, because unfortunately we do pay more for prescriptions here. We'll see how that pans out. I was just watching the news this morning and we're talking about putting tariffs on drugs. So we'll see if how that's going to pan out. The next option you have as far as getting insurance in Medicare is going to be a Medicare Advantage plan. These are known as Part C plans. They're offered by private insurance companies. They've been approved by Medicare, and it's an alternative to having original Medicare. You still have to pay your Part B premium. How this works, folks, is because claims are no longer going into Medicare. It's being passed off to the private insurance company. Medicare is now going to pay that private insurance company. I'm going to pick on United Healthcare because they're so big and national. So they're going to pay United Healthcare $1,100 per month per beneficiary that's enrolled into their Advantage plan. Now, their requirement is to use 80% of those funds for the actual plan benefits itself. So they get to keep 20% to pay overhead costs, people like me, things of that nature. Okay, that's how these Advantage plans are able to add additional benefits that are not provided by Medicare. So I know you probably get inundated with phone calls about a food card and utilities and over-the-counter benefits and dental and vision and all that fun stuff. That is how they're able to add those benefits to those particular plans. And they know the more that they add to those plans, the more likelihood they're going to have to attract you to it and you're going to enroll. Also, most of your Medicare Advantage plans include prescription drug cost as well. Now, this is going to be kind of a flip as far as when you're looking at medical expenses, because generally your Medicare supplement is providing you much more comprehensive coverage, paying a lot more of your out-of-pocket expenses on your medical, where an Advantage plan, you're going to take on greater risk, have a larger max out-of-pocket, but you're going to save your premium dollars. Okay. So I always say it's like going to the store. You can go to Chevy, you can go to Cadillac, they'll both get you there. It's just how do you want to get to the store? So when do we enroll? Well, we got all kinds of enrollment timeframes. The first one you're going to have is your initial enrollment period. And this is a 7-month window of when you turn 65. It's going to happen 3 months prior to your birthday month, and 3 months after. Okay, so you have a 7-month window to sign up. That doesn't mean you have to sign up in that 7-month window. Again, if you've got credible coverage and you're going to continue to work, you can opt to not sign up during the initial election period. You can wait and create a special enrollment period. So coming off an employer plan that has credible coverage creates a special enrollment period. There are probably over 20 different special enrollment periods. My plan is leaving the market creates a special enrollment period. I've moved to another state creates a special enrollment period. We've had a flood or a fire disaster that creates a special enrollment period. Medicare Advantage, most of the time when you're going to switch plans, when you're on Medicare, is going to be during these 2 different time frames. The annual enrollment period, which is coming up now, that runs October 15th to December 7th. So all my Medicare beneficiaries, we're updating their information and we're going to shop for their plans for next year and see if they need to make any kind of a change. I will tell you there are changes all over the place in every state with these Medicare Advantage plans. If you're on one, I highly recommend that you explore your options. Please work with a licensed agent or broker who knows these plans because it gets very confusing. The open enrollment period, I call this your one last opportunity. So perhaps you signed up for a plan during the annual enrollment period. Maybe you talked to some savvy salesperson on the phone and they sold you a bill of goods and you woke up on January 3rd and realized, wow, my meds aren't covered and my doctor's out of network. Now what do I do? Well, Medicare is going to give you one last opportunity to switch that plan during the open enrollment period to a different Medicare Advantage plan. That runs January 1st to March 31st, and you only get one opportunity. We don't talk about this enrollment time frame. As a matter of fact, Medicare will frown on agents discussing this openly in most circumstances, other than doing like a Medicare 101. We are not allowed to solicit for this enrollment period. However, if you call me up and Shelly says, hey, I'm in the wrong plan, can you help me? I'm going to say, yeah, I can. I got one last opportunity to get you out of that plan. Okay. Medicare supplement enrollment works a little bit different. Okay. They're not locked into a specific time of the year. But what I will tell you is when you're turning 65, you do have a 6-month window of or when you sign up for Part B, you have a 6-month window of being able to go into a Medicare supplement with no medical underwriting. Your Advantage plans have no medical underwriting. You don't have to answer any health questions. However, if you have certain chronic conditions, there may be certain plans that may be better for you. But Medicare supplements are still subject to medical underwriting, okay? So when I talk to people as they're progressing on to Medicare, we go over this because why? Maybe they have a pre-existing condition. If they don't sign up for a Medicare supplement during the 6-month window, they may never make it through medical underwriting and ever be able to get into the program. So this is something we talk pretty heavy about with this open enrollment timeframe. Otherwise, if you're trying to move to, let's say, a different supplement, maybe you're on United Healthcare and you got that 20% rate increase, and now maybe you'd like to take a look at Mutual of Omaha. If your 6-month window is over, you will be subject to medical underwriting. There's a lot of reasons medically why they will decline you. If you've had, maybe stents put in, AFib, certain medications, pending surgeries, previous diagnosis of cancer, heart attack, stroke within a certain time frame, been in the hospital in the last 12 months. These would be all reasons of an automatic decline. So I spend a lot of time educating folks on supplements and making sure they're aware of this guarantee issue during this 6-month window. So as I was just mentioning, there are several other, as I was going to mention, there are several other GI situations or guarantee issue. So if you lose coverage, so for instance, we have several Medicare Advantage plans leaving the market next year completely. So either you have to go sign up for another Medicare Advantage plan, or it's just created a guarantee issue window for you to go into a Medicare supplement. So if you missed the opportunity when you were new to Medicare or when you first signed up for Part B, now is another time you would have that ability to get in guarantee issue. All plan options may not be available. So Plan C, Plan F in the Medicare supplement world, those are no longer available for any individuals who have Medicare eligibility after January 1st of 2020. If you were on Medicare prior to that, you're grandfathered in and you're still eligible for Plan C and Plan F. Star ratings. So Medicare likes to rate how the plans are working. This is the Advantage plans and the prescription drug plans, and they're assigned a star rating from 1 to 5 each year. Now in 2025, we only had 7 plans that had 5-star ratings. Last year, just in the state of Ohio alone, we had 5 insurance companies that had 5-star ratings. So Medicare, I think, is kind of cracking down and on monitoring these plans and how well they are performing. This is based on member satisfaction surveys, the plans, providers. It has 40 key factor performance measurements. So if you happen to get a phone call from your insurance company because they want to do a survey and ask you how the plan is performing for you, this is why. There's additional information that is available on Medicare.gov. You can shop plans on Medicare.gov and it will indicate what the star ratings are on those plans. The 2026 plan ratings have not been released yet. We'll probably see those by the end of October. They don't come out quite right at the beginning when everything starts, so they do delay those a little bit. I try to stay away from plans there are 1 or a 2. You want to stay in 3 or above. That's me. My promise to you, our slogan is we make it simple. That's our job. We know this is confusing. I probably just confused a whole bunch of people trying to go over all of this because it's a lot of information to retain. We take our time. Our initial meetings last somewhere between 1.5 hours to 2 hours because we want to make sure we go over everything very thorough and answer any questions that you have. So we would be more than happy to take our time and explain all of this lovely stuff with you. When it comes to coverage, you've got a few options. So if you're going to continue to work and your employer has over 20 employees, you may be able to actually opt out of signing up for Medicare right away. That's the key right there, is 20 employees. In the eyes of Medicare, they recognize a large employer at 20 employees. Okay, which means then the employer plan is going to be primary insurance and first to pay. Medicare would be secondary. It makes no sense to spend the money for Part B of $185 a month for coverage that's not going to kick in until you meet the deductible max out of pocket on your employer plan. So you might opt to delay signing up for Medicare. If it's under 20 employees, it's going to be the opposite. That means Medicare is going to be primary and the employer plan is secondary. So if you don't sign up for Medicare and you're on a small employer plan, the insurance company will make the assumption that you do have Medicare in first position and they will process the claims accordingly. So what that means is they will factor in what Medicare should have paid for that claim and then pay according to your employer plan. What it could do is it could actually increase the amount of cost for your services. So this is, again, another question that I present to folks. Please find out how many employees you have, because we need to know what the coordination of benefits is going to be. If you're military, you could sign up for VA. You have CHAMP, TRICARE. Those are available as well. You can also sign up for going into Medicare and get your Part C Medicare Advantage plan, which could include your prescription drug coverage. Or you could do the last item, which is keep original Medicare, sign up for a Medicare supplement, and elect a standalone prescription drug plan. So we go over all of these different options with folks and see what's going to be the best fit for them. And I have told people, you might be better off staying on the employer plan. Maybe they have a very expensive medication and it's covered very well underneath the employer plan. Some of the things that I ask for so that I can do my analysis is, when do you plan on going on to Medicare? When do you turn 65? Do you have a spouse, dependents? Because we may have to address coverage for them as well. Where do you live? Are you a snowbird? Do you travel? Who's your primary care doctor? Here in Ohio, we have some large primary care physician networks that only contract with certain insurance companies. And if we know up front that that's one of your doctors, then we know right away that we need to focus our attention on those specific insurance companies. Do you have a specialist? We want to make sure that they're in network. Specialists can get very expensive if you're out of network. Are you taking medications? We will definitely explore getting your biggest bang for your buck, because prescriptions can be very expensive and formulary lists vary by company. So if you haven't shopped prescription drug coverage and you're on Medicare in the last 3 years, I highly recommend that you do. And then, are you looking for certain services? So as I'm talking to my folks now, updating their information that are on these Advantage plans, I'm asking them, what are you using in those extra benefits? Are you using the dental? Do you need it? Do you wear glasses? Are you able to drive to doctor's appointments? Do you need transportation? Do you have any type of chronic conditions that might need to be addressed for additional care? So we ask these type of things because we're going to try and tailor make your options to your needs as best as we possibly can. So when you're ready to find a plan, just give us a call. There's a QR code on the screen. That QR code will take you to our website. On our website, you can send a request for a consultation. They are a no cost, no obligation consultation. I am licensed in 4 states: Ohio, Florida, North Carolina, and South Carolina. If you're in a different state, I do have the ability to find you a local agent. I am part of the National Association for Business Insurance Professionals, and we network throughout the United States. And these are reputable agents versus sending you to a call center and God can only know what will happen there. I have my contact information as well on the screen, office number. I also have 2 other agents who work here as well, and they are also licensed in other states. And that is the end of the presentation, Joel, and we can open it up for some questions if we have some questions.
All right, very good. Can you hear me?
I sure can.
All right, so I think my camera might be froze, but actually my voice is coming through, so that's great. If we have any questions, you can unmute yourself and ask them. We'll hang out here for a little bit of time. Sherry, we appreciate all the information as always. That was a fantastic job. And I, for one, even though I've sat in on a couple meetings with clients, learned a little bit again as we went through this. I think the fact that this rapidly changing and there's many changes coming down the pike, and we always think, I think that, I'm turning 65, I need to sign up for Medicare. But I think it's just as important after hearing you talk a little bit that people already on Medicare that have a plan to keep it up to date and to review it based on their changing situations. And that's one of the things that I think is a real big positive for the people listening today, because I know some people are already on Medicare. So that would be just a no-brainer from my side to say, hey, let's just take a review of it and see if it's still the plan. Maybe it is. Maybe we get 100%, A-OK checkup, but also we might find out that there's a better plan out there that could save you some money or address the needs better going forward.
Absolutely, Joel. And one thing I'll mention is the annual notice of changes, they're out. They're in the mail, and they need to be in your hands by October 15th. So please watch your mail for information coming from your insurance company, because there definitely are some changes. There's some increases in premiums on the Part D plans. Some of the Part D plans are leaving the market nationally. We have a downsizing of Advantage plans taking place. So, you wouldn't want to wake up January 1st and realize I don't have a plan.
Okay, so we do have a question from Luann. I'll read it, and that she says, does the $2,000 max OOP for drug coverage pertain to all insurance beginning in 2025? Question number one. And then does it carry over if you meet the $2,000 OOP prior to enrolling in Medicare mid-year upon turning 65?
Okay, so the cap applies to all plans in the Medicare sector, and next year it'll be $2,100. So all Advantage plans, all Part D plans will have a $2,100 cap. For employer plans, it's going to work a little bit different. There's this whole actuarial process that they have for employer plans, because employer plans are designed a little bit different when it comes to insurance, because generally that cap is one max out of pocket for the medical and the dental, and it can be very well much higher than $2,000. So they have created a different formula for employer plans, but it does still have to meet a certain actuarial value on those employer plans. And that does go into effect for next year. There was a buy on that for this year because employer plans and nor the insurance companies were really prepared to address the $2,000 cap this year for the plans, because because of the designs of the plans, they weren't quite sure how that was going to pan out. So it is done a different way, and it will be implemented for 2026. So if you're on an employer plan, please pay close attention. Please do your due diligence to ask for that annual notice that it is credible coverage on the employer plan.
Okay, fantastic. We'll wait just a minute to see. But one thing I want to make sure that I let everybody know, we did record this session, and we'll send it out afterwards, after it's edited a little bit. So there's so much information that I think it'd be great for everybody, not only that was on the session, to go through and listen again, but if you have anyone that may benefit from it, feel free to forward that session to them so that they can listen and learn, and then reach out to Sherry if they have any questions. Thank
You're
you for
welcome.
the detailed information. And again, you'll have all of Sherry's. We'll put it in a follow-up email when we send out the recording, all her contact information. And as she said, if she's not licensed in the state that you live in, she can find you a credible person to work with, which I think is extremely important. I don't think I would say for sure, and not knowing anything about it, you don't want to just call into a call center and end up with the customer service person of the day, and then potentially get a plan that isn't right for you, and it costs you many thousands of dollars. So we appreciate your time. We're absolutely thrilled that you could make it today. So thank you very much. Thank all of you for signing on. And I think that's it. So we'll sign off now. Have a great day, everybody.
All right. Have a good day.
All right. Bye-bye.
Thank you.